So today I will be doing the Glasgow Coma scale on my patient, Daniel. So the first thing that you're going to want to test when you do this exam is you're going to want to test their eye movement. So the first thing I'm going to do, obviously I wouldn't be talking when I walked into the hospital room because that would take away part of the vision test, but assuming I just walk in, I would walk up to the patient and look for a what we call 4, which would be a perfect score on the vision portion of the GCS, and I would just come up to the patient and look at his eyes to see if I can get an opening without saying anything. So in this case, I do not. So then I would go on to the next step, which would be a 3, which is the eyes open to noises. So I would say, "Hi Daniel, I'm Andrew. I'm going to be your physical therapist for today, student physical therapist. Can you hear me?" So he did not open his eyes again. So then to continue testing for the 3, I would just say a little bit louder. "Can you hear me, Daniel?" "Hi." So he did open his eyes. So he would be scored a 3 on the Glasgow Coma scale for vision. And then if he were to have not opened his eyes for that, I would test him by pressure. So I would just take his finger and hold his finger for about 10 seconds and see if I can get the eyes to open, and that would be a 2. And then a 1 would be no response to anything whatsoever. His eyes would remain closed the entire time. So the second portion of the test is going to be the verbal portion. So now that I've walked in and I've tested his spontaneous eye opening, I would then introduce myself kind of like I did with the vision, and that would play into the verbal part. And I would say, "Hi Daniel, I'm Andrew. I'm going to be your physical therapist for today. How are you today?"
I'm doing good.
Okay, and where are you at?
I'm at the hospital.
Okay, and do you know what month it is?
It's May.
Okay, so notice how I asked him for his name as well as where he was at and the month that it was, and he answered all of those correctly, and it made total sense. So that would be a 5 on the Glasgow Coma scale. Now, if he were to have answered in a incorrect way, if you were to answer them in complete sentences but it was incorrect, that would be a 4, and then a 3 would be if he just used kind of inappropriate words. So if I, for example, I said, "What month is it?" He said, banana or whatever, and it was not the appropriate words. That would be a 3. A 2 would be he responds with sounds such as like a moan or a groan, and then a 1 would be no response to anything. So then the final part is going to be the motor part of the Glasgow Coma scale. So the first thing that I'm going to do is I'm just going to come up to him and say, "Daniel, are you able to reach for my hand and squeeze?" Okay, so notice how he was able to do that. That would be a 6 because he was able to follow a command and squeeze my hand. Now, if he were not able to do that, we would then go down to score 5 and assess for that. So what I would do is I would come up to the trapezius and I would just go ahead and pinch. Okay, and the response would be he would localize to the pain, so he would move my hand away, which he did there. So that would be a 5. Then a 4, how that would work. The other thing too about is if the patient is unable to feel something around here as well, you can also do it up at the supraorbital notch, and that would elicit the same response for 5. But as I was saying, for a score of 4, you would see so I would kind of be looking for that withdrawal reflex. So I would pinch his finger and I would expect him to just move it away. Or if I went down here to the trap, I'll come over onto this side, he would kind of shy away from the pinch. That would be a 4, which is the withdrawal reflex. A 3 would be if I came and pinched and we got abnormal flexion. So he was able to flex up kind of to the area, but he wasn't able to pull it away. That would be abnormal flexion. And then lastly, a 2 would be if I pinched at the trapezius and I got an abnormal extension response. A 1, as usual, would be no response. So if the patient for the vision part of the test was unable to open their eyes due to swelling, you would put an NT on the test. And then for the motor, if they had some sort of paralysis, they would be unable to do that portion correctly, so they would be put as an NT. And then if a patient has an endotracheal tube or a difficult time talking, you would put NT for that portion of the test. And since Daniel here was able to follow command, he would get a 6 for the motor portion. For the verbal portion, it was comprehensible and it was correct, so that would be a 5. And then he didn't respond until I talked to him. It wasn't spontaneous, so that would be a 3. So his total score would be a 14 out of 15. The highest score would be a 15. They'd be fully awake, and 3 would be the lowest you could get, which is completely in a coma. Thank you.